Respiratory system, nose and nasal cavity. 1. Introduction to the respiratory system. 1. The respiratory system is responsible for gas exchange, oxygen and carbon dioxide, in the body. 2. It consists of the upper respiratory tract, nose, nasal cavity, pharynx, and the lower respiratory tract, larynx, trachea, bronchi, lungs. 2. Nose and nasal cavity. A. Nose. 1. The external nose is the visible part of the respiratory system. 2. It is composed of bone, nasal bones, and cartilage, hyaline cartilage. 3. The nose has two nostrils, external nares, that allow air to enter. 4. It is lined with sebaceous glands and hair follicles to trap dust and particles. B. Nasal cavity. 1. The nasal cavity is the internal space behind the nose. 2. It is divided into two halves by the nasal septum, made of bone and cartilage. 3. The nasal cavity opens into the pharynx through the internal nares, choana. 4. It is lined with mucous membrane and cilia, which help trap dust and microorganisms. See functions of the nose and nasal cavity. 1. Air filtration, hairs and mucus trap dust and microbes. 2. Air conditioning, warms, humidifies, and moistens incoming air. 3. Olfaction, smell, contains olfactory receptors in the olfactory epithelium. 4. Resonance for speech, contributes to voice tone and quality. D. Nasal conchae, turbinates. 1. The superior, middle, and inferior nasal conchae are curved bony structures inside the nasal cavity. 2. They increase the surface area for warming and humidifying air. 3. They create turbulence to slow airflow and enhance filtration. E. Paranasal sinuses. 1. Air-filled spaces in the frontal, maxillary, sphenoid, and ethmoid bones. 2. Functions. Lighten the skull, enhance voice resonance, produce mucus to keep the nasal cavity moist. F. Blood supply and innervation. 1. Rich blood supply helps warm incoming air. 2. The trigeminal nerve, CNV, provides sensory innervation. 3. The olfactory nerve, CNI, is responsible for the sense of smell. Clinical conditions related to the nose and nasal cavity. 1. Rhinitis, inflammation of the nasal mucosa, e.g., due to infection or allergies. 2. Sinusitis, inflammation of the paranasal sinuses. 3. Deviated septum, misalignment of the nasal septum, causing breathing difficulties. 4. Epistaxis, nosebleed, can be caused by dry air, trauma, or hypertension.